Okay, again, good morning. This is Dr. Garais, Med110 6DAX, and I believe today is June 24th, and this is week 5. We have no midterm for this particular class, but we have a final, of course, and that'll be in week 9 and week 10. That'll be online. So your midterm grades are due this Saturday, and whatever you submit, like I know week four stuff is due today. So essentially, your midterm grade is from week 1 through week 4. But if you if you do your week 5 stuff, you do your week 5 stuff. The computer doesn't distinguish that. So even if you do your week 5 items, before Saturday, and try to do, just to get it out of the way, it'll calculate your grade as is. And remember, your midterm grade is not a real grade yet. That's not going to go in your transcript or whatever. So if you have subpar grades, especially if you're a candidate for our School of Nursing, you got 5 more weeks to do something about it. Okay? But every week, every week is 10%. So if you don't do something, it kicks your grade. If you don't do your task, your lesson, and your discussion, it kicks your grade down 10%. So always try, and of course my message is, even if you submit it late, some credit is better than nothing. Okay, so and I'm super lenient, even though the policy states that in 4 days you get a 0 in all intents and purposes. So if you're late a week, but I'll give you at least something for your trouble. And also remember, you're building up knowledge for not only this class, not only this final, because you will see all of these things again in your pathology course and in your other nursing courses. So this week, it's apropos that I was eating my muffin and drinking some water, because today we'll be talking about the gastrointestinal system, the digestive system. And the function of the GI system is, and we kind of looked at it before when we were looking at enzymes, we're taking this muffin that I ate and the water that I drank and the oxygen that I breathe, and this entire thing here, which we're going to show momentarily, deals with converting all of that to energy, and anything we don't need is considered waste. So remember what I always talked about: too much of a good thing becomes a bad thing. So too much nitrogens, that becomes azotemia. That's all intents and purposes, that's poisoning of your blood if you don't let go of some of the nitrogens. And we already discussed in previous lectures, we need proteins, of course, but not as many nitrogens as the body, intakes. So carbon, hydrogen, and oxygen, and that's what we're going to do to make glucose. And we already know that glucose goes into the mitochondria in the cells, and then the mitochondria kicks out ATP, adenosine triphosphate. And in the respiratory, we throw out, the waste is carbon dioxide. So we're going to go over, and this whole thing that I just described to you is metabolism. Let me draw like a little diagram of that. Oops, why is my nursing plan up? Maybe because I was doing nursing stuff yesterday. Okay, so let's look at an overview of what we mean by metabolism. So we take food, okay, and it has carbons, hydrogens, oxygens, and nitrogens, okay? And those were our organic compounds that we discussed, I think, in week 2 or 3. And then it's metabolism. Meta, change, bol, growth, ism, process of. So it's a process of changing this stuff into fuel. And the fuel we need is glucose, a 6-carbon sugar. Of course, that glucose goes inside the mitochondria, and the mitochondria makes adenosine triphosphate. And we now know that ATP is the metabolic fuel that we need. And of course, this is the digestive system. And a side product of this is waste. So I can draw, let's see. So the stuff that I don't need, right, from my metabolism, that will be waste. Anything that's extra is waste. Okay? So we need some nitrogens, but not a lot. So that's why when you urinate and when you defecate, it's got a decent amount of nitrogenous waste in it, and that's nitrogens, because the majority of the things that I need are carbon, hydrogen, oxygen, which, by the way, that's what a carbohydrate is, and that's what glucose is. So it has to be a balanced meal of carbohydrates, fats, and proteins, okay? So you can't, like, all these hardcore diets that say, oh, we can do away with proteins or we can do away with fats. That's a lie. You need a balance, right? And also, regarding dieting, it's portion control, because we're the only species on the planet that eats beyond its capacity, right? And how do I know? How do you know? Well, every time you go to a buffet, right? You've already had 6 plates of snow crab legs. And then you look at the cheesecake. It's obvious you're done, but you go, maybe I could eat a little more, right? And that's actually the key to dieting and exercise, everything in moderation, and also a portion control. And we need to know things about this, because knowing your anatomy and physiology, because it will help explain better the reasons why the diets are the way they are. And the better diets, the ones that aren't so restrictive, because that's a real challenge. So metabolic, carbohydrate, lipid, protein metabolism, they all have to be changed, right? And we're going to talk about, are we going to talk about energy and heat balance? Well, we'll see. Let's see. So right off the bat, let's talk about right here, the structure of the digestive system. So who are our players in the digestive system? And let's look at our textbook. And right here, and it's the openstacks.org. And openstacks.org is neat because they not only have anatomy and physiology textbooks, they have other things. So you go here and let's open this up a little bit. Go to your table of contents, and we're going to go down, and we're going to find tissue, support, movement, integumentary, bone, axial skeleton, appendicular skeleton, joints, muscular, that's all anatomy, physiology 2. Where's digestive? Maybe it's further down.
I think you said it was chapter 24.
Yep, there you go. Thanks. So I don't even know my own class. I've taught it a million times. All right. Hey, early onset dementia is rough. All right. Thank you for reminding me. So we already now know what metabolism is. Meta, change, bowl, so we can grow, right? So the second we stop eating, the second we stop having proper intake, it's going to cause a whole bunch of problems. And we as Americans are classic, classic examples of which. And many other countries are copying us. We're not the only ones, because now that fast-paced lifestyle and consumer lifestyle and the McDonald's lifestyle, is very conducive to just sitting around and waiting for the food to come. So metabolism is broken down into 2 parts: anabolism and catabolism. Now, I'm going to sneeze. Anabolism is growth. Ana, parts. Catabolism is breakdown. And there are certain reactions that help us break down. And here's a nice example of what I was talking about. Was we take food, and then you take proteins, complex carbohydrates and the fats in the form of triglycerides, which, by the way, this is how you measure how much fat you have in your system. You look at triglycerides and other things, right? And of course, if I have too much, I try to store it in the form of, and glycogen, it stores in the liver as fat. That's why if you eat too much, drink too much, you're gonna get a fatty liver, and then eventually that fatty liver is gonna harden up and to something that we all know and love, cirrhosis. But you could see here, everything is to break things down into its basic parts, like glucose, complex carbohydrates break down to glucose. We talked about it, and it's gonna make me some ATP within the mitochondria, right? So all of these things, these like green arrows, are catabolism. They're breakdown, right? Now, we're going to also have some anabolism, this green, right? It's going to build some stuff. So when the proteins get broken down, they get broken down into amino acids. And then the essential amino acids then get recycled. And then we have some protein synthesis, and there's a picture here of your muscles. And if you don't work out, do you need it? Nope. And then that gets thrown away. But if you have regular exercise, that protein can be utilized. Same thing with the fats, glycerol and fatty acids. If you eat too much, like I do, I'm going to have a lot of lipid. I'm going to have a lot of storage right here in my gut, which I do, right? And if I don't work out, it won't break down. And a little side note, we already talked about how the pancreas releases insulin so that glucose can go inside the cell and can be utilized. Guess what? If you do not exercise or do not move around too often, it'll just store it all. Nothing will be broken down. And the funny thing, not funny, but the really interesting thing about exercise is that exercise forces this, the breakdown of stored fat. You don't need insulin. So if you exercise regularly, and what do I mean by exercise? The American Heart Association says at least 3 times per week, where you're doing some cardiovascular exercise, where at least for 30 minutes you're going at your peak heart rate. I just got back from the gym. The gym finally opened up a couple of days ago, and I still see the same people on the treadmill. You know, they're walking, they're talking on their phone. If you can talk in full sentences while you're working out, it's not a workout. You have to be a little bit winded. And I used to have a heart monitor all the time. I used to be a runner, but now this is how I gauge. Can I speak easily? If not, then I have to increase my workout. So catabolism are these processes of breakdown. Anabolism is the process of building back up. And the neat thing also, I'm going to make another side note here about fitness and wellness. When you do work out, you're going to need more proteins. That's going to eat up more energy, right? So even if you do a decent amount of cardio, you also have to hit some sort of resistance training or some sort of weight training to build up your muscles. And it's also good for movement on your joints. Because the funny thing about your body, if you do not use it, you lose it. And it's the same thing also with your gastrointestinal system. I don't like, those gastric stapling. Me professionally and academically, I don't like any of those things that alter, the anatomy of the stomach. Because number one, it's semi-efficacious. It doesn't work all the time. And number two, if you don't use something, you lose it. And then you have these complications where whole sections of your gastrointestinal system will shut down because you're not using it. So starving yourself out is never a good thing. Jumping into diets or exercise wholeheartedly without easing yourself into it is not a good idea for the human body. So catabolism, right? Breakdown. We know glucagon will break down fats. You need cortisol from the adrenal gland to break down fats and proteins to make glucose, and that's called gluconeogenesis. And of course, We already discussed the role of adrenaline and epinephrine. You need that for fast energy, especially in your fight or flight. You're running away from a dog, or you're in a fight. You're going to need sugar really fast. So adrenaline, also known as epinephrine, will break down really fast. Now, the anabolic hormones are things that'll make you grow, like growth hormone, growth factors. Insulin makes you grow because that gets the glucose inside the cell so you can use it. Testosterone, of course, and estrogen. Those are the main hormones, your gonadal hormones, especially during puberty and pregnancy. So those are definitely anabolic hormones. And you could see why athletes love anabolic steroids, because they simulate or upgrade testosterone. They also upgrade growth hormone. But again, if you're messing with natural things, they'll be very you'll have some signs and symptoms. I was watching yesterday the women's national swimming championship. There's several women there that I see signs and symptoms of performance enhancing drugs, PEDs. But you know how the testing goes. They test negative, so they're good. And there's certain sports they kind of ignore, right? CrossFit's one of them. Look at the top 3 CrossFit women's. It's super obvious they're on something. Not good. Oxidation reduction reactions, they're also called redox. Just know those are the reactions that that break down and reduce electrons to make ATP and to break down fats. That's like that's the easiest way to explain it without going into a prolonged what do you call that, biochemistry, which will, by the way, you'll be seeing all of this again in greater detail in biochemistry. We already know glucose glycolysis that happens. That's gonna sugar lysis, breakdown, and of course we have to break down complex sugars so that we can make our 6-carbon sugar. And there's an example. I'm breezing through this because all of this is biochemistry and we're in an anatomy class. I want to get to I'm gonna not breeze through it, but I just want to get you like the broad strokes of how all of this works. So in the mitochondria, you're gonna have this thing called the TCA Krebs cycle. And the TCA Krebs cycle, also known as the citric acid cycle, they're going to take that glucose and they're going to break it down. And they're going to break it down into these acids and all of that. And if you see, it's going to start kicking out these NAD and NADHs, right? And when it does that, it's going to create, at the very end, adenosine triphosphate. So carbohydrate metabolism, lipid breakdown, right? All of that, because remember, has to deal with breaking down the food that you just ate in order to create ATP. Now, where does ATP actually get created? It's within the different walls of the mitochondria, and it utilizes something called the electron transport chain. And just like the name suggests, it transports electrons from one thing to another. So it creates, you can see here, adenosine diphosphate transfers the electrons over, and then you have adenosine triphosphate. And you could see it messes around with ions. And if you notice, the ion that they messed around with is H+, and it makes sense because there's a whole bunch of amino acids and acids that take place. And also, you could see here, requires an enzyme. And remember, enzymes help move things along. So you have, of course, ATP synthase, and you're required to make ATP. And all of this in the electronic transport chain occurs in your cells in the mitochondria. Now, let's look at some breakdown of lipids. And this is a triglyceride. So let's look at the word triglyceride. And you'll see it abbreviated as TG in lab reports and things of that matter. So it's 3 glycerides, 1, 2, 3, which are long chain carbohydrates, which are essentially fatty acids. So they can get broken down into monoglycerides. And we have enzymes from our pancreas and our bile salts. That's how we break down fats. And that is from our pancreatic lipases. And how do I know? Lipase, ACE is, what do you call that? Is the suffix for enzyme, and it's from the pancreas. And also bile salts, which are created in the liver, and then they get stalled in your gallbladder. And of course, a hormone called CCK, cholecystokinin, is also released, and that was when you eat a lot of fat, and releases these pancreatic lipases. So what do these things do? These things are called emulsifiers. They break down fat. So they're going to take this triglyceride and then break it down into this, which is a monoglyceride. And it makes sense. What's easier to digest? Something with all of these carbons, or something like this, something that's simpler? And of course, it's easier to digest something that's simple. And they make these little vesicles, right, from big fat globules into little tiny fat globules, also known as micelles, also known as chylomicrons, okay? And this entire process is called lipolysis. And you could see here, it's really important in the mitochondria as well, because where do you think we got our glucose from? And it goes through your TCA cycle, which you see here, breakdowns. Now, what's ketones? Maybe you've heard a lot of this, and especially in diets. Now, normally, when you're not starving and you know, you're in between meals, your glucagon gets released from your pancreas, and it tells your body, hey, well, it tells the fat, hey, break down some of these triglycerides so I can have some energy, okay? Now, the problem with glucagon in a starvation state, let's say you didn't eat for the last 10, 12 hours, instead of making glucose, right, it makes this thing called a ketone. Now, ketones are a good source of temporary energy for your body, and especially for your body. But the problem is, ketones are neurotoxic. They're actually not good for, so starvation states, starvation diets, and especially Atkins 1, those diets, they're very dangerous, especially for a diabetic, because they will create ketones, and ketones are very neurotoxic. And you could go into diabetic ketoacidosis and then get in a coma, right? Now, how do you know you got ketone bodies? You ever see that commercial for Snickers, you're not you when you're hungry, right?
Mhm.
Try not eating for like half a day. How you first get a little bit silly, right? And how about, have any of you ever not eaten for days? Many moons ago, I was on an ops, and we missed our ride home. So we had to walk home, and that was almost 5 days. But the problem was we only had food for one. So by the 5th day, how do you think we were all acting? We were all acting borderline psychotic, like really crazy. Um, um, I got into a knife fight over a candy wrapper. One of my compatriots thought I was hoarding food and accused me, and he took his knife out and I took my knife out. It's because why, right? You know, we're brothers in arms, but why did we do that? Well, we didn't eat for 4 days, and we have now our ketone bodies, and ketones are now floating in our brain. We don't have enough glucose for food. We don't have enough oxygen, right? So what happens? You get weird, and you get really weird. For the first day, we were all giggling, making jokes or whatever. But by the 4th or 5th day, oh, it was just everyone hated everybody, and we were really considering murders. It was a very, very scary thing. And don't you think that if you're patient, is on a crash diet combined with any other mental disorder or combined with any other metabolic problem, do you think now they're going to have some mental issues? Yeah. So eating right, and especially if you're in a psychiatric ward or a ward with high-risk patients, you got to pay attention to what they eat, when they eat, and how they eat, because you don't want ketones to start building up, especially with a diabetic population. Now, protein metabolism, we mentioned it before, and we're going to talk about the digestive tract, momentarily, right? A lot of it happens in your stomach, and there are digestive enzymes and hormones, and a lot of it is in enzymes in the stomach. So you have trypsin, chymotrypsin, trypsinogen, chymotrypsinogen, all these enzymes. Now, if you see an ogen or gen at the end of a hormone or something, that means it's inactive form and that has to be activated. Well, there's a reason. There's also another reason why your stomach acid is you have stomach acid, why your pH of your stomach is very low, like at 1, because pepsin and hydrochloric acid help break down the proteins into amino acids. The two greatest things that break down proteins are heat and acidity. And what better place in your stomach? So, of course, pepsin will break down peptide bonds, and peptide bonds are what connect amino acids to make proteins. So now you know that this whole system is geared to break down carbohydrates, break down lipids, and break down proteins in order to keep and maintain metabolism in your body, and a balance of catabolism, breaking down things, and a balance of growing things, anabolism. Okay? So let's now look at the digestive system and then see how all those enzymes and all those things all work together. So these are all the players. And the main players are the tubing. From your oral cavity to your throat, which is your pharynx, down your food tube, the esophagus, through your stomach, through your small intestines, large intestines, down to your rectum and out your anus. So the whole function is for both metabolism, breakdown, and metabolism, of course, has the two parts. Anabolism, for me to grow, right, get some fuel, and catabolism, to break down things to its basic parts, and anything that's extra ends up as waste. So your GI tract, also known as your alimentary tract, also known as your gastrointestinal or gastroenterologic tract, starts with your oral and goes all the way down, okay? And then now we're gonna go through each and every one of the processes of each part on how does it do it. Now, if you notice here, we always study all the systems in a vacuum, but in real life, you could see how all of them are all related together. Like for example, cardiovascular system. You have a large blood supply to your stomach. That's the reason why when you eat massive fatty foods, why do you get sleepy? Because then your body starts drawing a lot of its nutrients and a lot of its blood to this area, and there'll be less blood up here for your brain, and then you get a little bit sleepy. I love at Thanksgiving where they keep on trying to blame, oh, why you're sleepy. If you eat turkey, you get sleepy because of tryptophan. That's crazy. No, you don't get sleepy tryptophan. Maybe it's the 5 servings of gravy and mashed potatoes along with your turkey, right? That caused it. We already know endocrine, integumentary system, calcium D synthesis, and just a little side note, you need vitamins because you remember our lecture from week 2. Remember what vitamins are? They're coenzymes. They are things that help the breakdown process. Lymphatic, there's a lot of lymph tissue because a lot of the food we eat is very dirty. Hence the other reason why your stomach is at a pH of 1.5, because no matter how well you clean your vegetables, and maybe some of you have tried this, just stick the vegetables that you get from the grocery, just put it in a big bowl of water for about 15 minutes. You'll see all the goodies in the water, even without scrubbing it or brushing it. There's a lot of chemicals and there's a lot of oils and waxes that are on processed food. And of course, respiratory, we need food and fuel for all of these. But another thing that you're constantly, well, not eating, but you're also constantly breathing. Because remember, I need oxygen and I need the removal of carbon dioxide, and that goes along with this system. So this is known as the alimentary canal or alimentary tract, also known as your GI tract. And there are accessory organs, and we talked about some of them. We talked about the liver and gallbladder and pancreas. So we're gonna be touching back on them as well. But the main parts of the tract are your, let's go back here to this picture. Your oral, your pharyngeal, your esophagus, your stomach, small intestines, large intestines, then out, okay? That's one whole big tube. It's just all bunched up. And the accessory organs are your spleen, your gallbladder, and your liver, and behind, a little bit under and behind your stomach is your pancreas, okay? And of course, salivary glands, and we're going to talk about that momentarily. So let's start with what's the tube made out of? Well, the tube is made out of smooth muscle, and smooth muscle is the kind of muscle you can't control. It's also called visceral muscle, and proof of it is when you eat something, can you tell your stomach not to stop? Can you tell your esophagus or your food tube to stop swallowing? You can't. It's automatic, right? And it has, you see, has a hefty blood supply, and it also has a hefty, you see this yellow here? Those are, let me make it bigger. There you go. You see this yellow here? Those are nerves, and that's part of your myenteric plexus. And plexus is just a fancy word for like a bunch of nerves all together. Okay, so your body does all of these things automatically. That's why dieting, right, you have to have protocols in place, because a lot of things regarding your food intake and your habits are all automatic. The only muscle you really can control in dieting is your bicep, you know, your arm muscles. It's the only thing preventing you from picking up that hamburger and putting it in your mouth, right? Also, by the way, when the second you see the burger, the second you smell the burger, you're going to want to eat the burger. So of course, just like the same things for other addictions, you have to just simply stay away from it. But again, easier said than done, but knowing and understanding that all of this is automatic, and that you are not really in control of it, okay? So nerve supply, myenteric, blood supply, we already talked about. Now, the entire abdominal cavity is covered by a double layer covering called your peritoneum. Now, the function of the peritoneum is not only for immunologic, it's got a lot of lymph nodes and lymph vessels in the peritoneum. It's also a nice covering. And it also has a lot of blood supply, because remember, this is a process, and these are muscles, and they need energy, and these processes need energy, therefore they need arteries and veins, okay? So you can only imagine if I puncture this and get peritonitis, right? Inflammation or infection of my peritoneum, it's not only one area that's going to get messed up. You're going to have what? All these areas is going to get messed up, okay? Now there's peritoneal folds. So you might hear some of these things. greater and lesser omentum falciform ligament. It's the ligament that connects the liver to the front part of your wall of your abdomen. We're going to see that in dissection. Sometimes it's called the mesentery, and a mesocolon is part of your large intestines. But these are nice to know. Don't need to know them exactly right now. But you're in surgery, you need to know them. We already talked about neural controls, the myenteric plexus, hormonal controls. We already talked a little bit of cholecystokinin, right? Not kinase, cholecystokinin, right? Which stimulates the pancreatic enzymes. We also talked about what the pancreas releases. We're going to touch on that again later. So finally, we got to the oral cavity. So remember, everything in the oral cavity is to help break down or to help digest. So remember when your parents or whoever took care of you told you to chew your food 20 times? Well, you have to have good dentition here, good teeth. You got to chew, and every time you chew, it releases salivary enzymes to help break things down. So let me see, where is it? These are teeth. Not going to show that part. The tongue also is a very strong muscular part of the oral cavity. Its function is to mechanically smash all the food into your hard palate. And that's the reason why, you know, when you eat peanut butter and jelly, it gets stuck to the top of the roof of your mouth, because when you watch your tongue chew, it's when you watch, hey, why am I saying it? Let's just show it. See a video of it. Chewing or mastication. I have a video. You know the X-ray thing? You ever see it?
Mm-mm.
Here you go.
Mm.
There's an X-ray of somebody chewing something. And we do these things. We do these videos because we want to see. Especially if my patient has dysphagia or difficulty swallowing, we want to look at these studies so that you know, we could physically find something wrong. So let's see. Is he going to chew yet? Okay. See, he's chewing. Now, one of the things that you're first going to notice, you have your muscles of mastication. All right, moving your jaw up and down. And if you could see here, do you see how, as there's chewing, this tongue here, you could see it's smashing things up on the top. And this is your hard palate right here. And then you have your soft palate here. Now, it makes sense that it has to be hard over here so I can smash it, right? And then soft here so it can go down. And do you see how the food just went down by itself? What you're not noticing is that that the esophagus, and this is your pharynx, but down here, your esophagus is lined with that muscle, that involuntary muscle, and it facilitates, like, you know how, the best way to put it is, you know how your drawstring in your shorts or your sweats, you know, when it comes out and you try to put it back in.
Mm-hmm.
How do you put it back in? You tighten up one part and you loosen up the other, and then you pull the string through, right? And then you tighten up another part and then loosen up another part, and then you pull it through. It's the same exact action that your esophagus performs in order to get the food down. And that's called peristalsis. And you can see if your patient has a neurologic, they're going to have a hard time because remember, your myenteric plexus organizes all of this automatically. But what if I had a stroke, or I had maybe some traumatic brain injury? I won't be able to eat or digest properly. So now you can see that that the tongue is not only a sensory that we already know, it also releases, also mechanically smashes food so that it'll be broken down even more. Now, another thing that happens when you chew, and also what happens when you see food. What happens when you see or smell food, right? Your mouth starts watering because you have submandibular, sublingual, and parotid glands, and they release chemicals, primarily salivary amylase, ACE, ASE. That's a enzyme. So saliva, right, is not only makes the food moist, but there's things in it, and the more you chew, the more saliva you have, and the amylase starts breaking down the carbohydrates. So that's one of the first things that happen. You have mastication or chewing, then those three glands, your submandibular, which is under your mandible or your jawbone, your sublingual, which is underneath your tongue, and your parotid gland, which is near your masseter muscle, near your cheeks. Now, where you know where your masseter muscle is. Pretend to chew. Put your palm on your cheek, and pretend to chew. You feel that little thing that kind of bumps out?
Mm-hmm.
That's your masseter. And right now, even I'm not eating anything, my mouth is getting moist. Because why? I'm chewing, right?
Mm-hmm.
It automatically starts pressing on these glands, and the glands are going to start releasing salivary amylase. Okay. Okay. Well, of course, regulation, salivation, and all of this is through the myenteric plexus. And again, like I said, if you have sialorrhea or excessive salivation, it could be a sign or symptom of a neurologic problem. Teeth, we're not going to go into detail, but it makes sense because you have good dentition, you have good gums, the teeth will be there, you'll be able to chew the food, and it'll be a much more efficient process. Now, another side note about your mouth. We showed the alimentary canal. It goes from your mouth to your anus, correct? Everyone's worried about what comes out of your butt because it smells, it's nasty, it's gross. But the thing is, medically, I'm only worried about Escherichia coli or E. coli when things come out of your butt. I'm very worried about your mouth because it has up to 200 to 250. I quoted that somewhere from a dentistry textbook that I once read. That they have 250 potential pathogens in your mouth. That's why if someone fell into a sewer, I'm not too concerned. You know, I give you some antibiotics. Just take a shower. Try not to do that again. But if someone bites you, a human bite, or you get into a fight and maybe cut your knuckles on somebody's teeth, you get a tetanus booster. You get broad spectrum antibiotics. You also get a wound culture. And I have to then see you in 7 days because I'm going to do culture and sensitivity for another set of antibiotics. There's a whole bunch of things I got to do if you get into a fight, right? And you have a broken skin secondary to any oral trauma or oral injury, okay? Teeth, yada, yada, yada. Pharynx, throat. Of course, this is your throat, your nasopharynx, and all of this, it shares with your respiratory. So you have your trachea here and your esophagus in the posterior. And you could see here, this is your epiglottis. This will separate your windpipe, your trachea, from your pharynx and oropharynx and laryngopharynx and your esophagus. And then that's the reason why whoever took care of you told you not to speak when you're eating. Okay, because what happens? You start to choke and if any of that food gets down here, that's a problem. It's also the reason why we intubate you during certain surgeries. And also before surgery, you're not allowed to have any food in your system because if you vomit, what will happen? A lot of that nastiness, remember, the food is dirty, and plus the acid. If that goes into your trachea, into your lungs, you'll get aspirational pneumonia. It's very hard to treat and has a decent mortality and morbidity rate. So you could, and this also explains the reason why if you're drinking milk and someone made you laugh, the milk might come up and go out of your nose, because when you're laughing, right, you're breathing, but you're when you speak, you're actually exhaling, but you're drinking at the same time. So your epiglottis, all of this gets confused, and you could easily see how the milk could come up here and then go out of your nose. I don't know why I use that example all the time, but that's the example I use. So epiglottis, trachea, which is a part of your respiratory, and your pharynx here, which is your throat, nasopharynx, it connects to your nasal passages up here, and your laryngopharynx, which is the area where your larynx or your voice box is, and then it connects all the way down to your esophagus. And you have the epiglottis here that cuts off the trachea when you eat or drink. So do not speak or do not try to speak when you're eating or drinking. Okay. Now, we already talked about esophagus, your food tube, and how it's automatic. And the automatic movement of food is called peristalsis. Now, sometimes you might eat something nasty, right? And you'll vomit. Vomiting is called reverse peristalsis. And in either way, can you control it? As a parent, I love when my kids try to control the vomiting. It cracks me up. I just tell them, just vomit already, right? Especially my daughter. She always has motion sickness. So she's like, huh, bleh, and I go, I'm going to pull over. She goes, I'm okay. I'm going to pull over, right? Because you cannot control when you vomit. Remember, your myenteric plexus and your esophagus, you can't control it. So once it goes down here, once the food's in here, whoop, it's going to go down. Now, this tube system has doors. They're called sphincters. They're circular muscles that close up kind of like a purse string. And your first door here, well, we saw the other door that was like a flap. That's the epiglottis. That was up here, this thing. But down here, this is the first part of the stomach. That door right here is called your upper esophageal sphincter, also known as your cardiac sphincter. And remember, your stomach has acid in it. So we would like to keep the acid in here. Now, the door and the lining of the stomach is covered with mucus, so it keeps it nice and safe here. But what happens when you eat or you vomit or you eat a bad street taco or you had way too much alcohol? What happens? The sphincter here can't keep all that extra acid, and then the extra acid will kick up and it will cause pain right around this area. And it's called the cardiac sphincter or the upper esophageal sphincter because, and maybe you've heard of this term, heartburn, right? You have like, you ate way too much of that, 5-alarm chili, and then it kicked up here. And 5-alarm chili is perfect because what creates acid? A lot of fat and a lot of salt, and it creates acid. And that's why people who have gastroesophageal reflux disease, I have a little bit of GERD. What happens? Gastro, stomach, esophagus, your food tube, reflux. Food and fluids and everything should be going down in this direction. Reflux means to flow backwards. Re means back. So all that acid will kick up in here, and it will ruin this eventually. And for chronic alcoholics, there's something called Barrett's esophagus. That's a form of cancer because this got all damaged because all they don't eat very well. All they do is drink alcohol all day, and they have severe GERD, and all the acid splashes up here and ruins all this. So peristalsis, that's the motion that gets the food down. You have your upper esophageal sphincter that holds this down, also known as your cardiac sphincter, and it could be the source of heartburn. Now, you have your lower esophageal sphincter, which is the lower part of the stomach. I'm going to show you in a minute. And that, of course, keeps things in the stomach until it's ready. Deglutition is just a fancy word for swallowing, and we already saw that part. And of course, you have different phases, but overall, the only phase you could really control is when you start chewing. But after that, not really. Let's get to the stomach so we can show the parts of the stomach. Now, the stomach's got parts, and we already seen the upper esophageal sphincter is right here, and then you have the another sphincter down here that connects into that separates the first part of your small intestine, which is the duodenum, and into their stomach. And you can see all the stomach is this muscle, multi-layered muscle with all these folds. These folds are called rugae. This term right here. There you go. Now, rugae helps the stomach expand and contract just like a balloon. So if you're eating a lot, your stomach will provide for that. But if you start lowering your food intake little by little by little, what's going to happen to this muscle? It's going to get smaller and smaller and smaller and won't accommodate less. But like I said, I don't like any of the gastric stapling. I don't like any of that other stuff because you're cutting off fuel, and you're cutting off arterial supply, and it might cause infarctions and blockages down the line, which I don't appreciate as a medical professional. Now, there are parts. The top part of the stomach is called the fundus. The main part of the stomach is called the body. And the part right here that's right next to the duodenum and your pyloric sphincter is called the pylorus or pyloric canal. So you have here cardiac, right, area, which is part of your cardiac sphincter, your fundus, top part, body, main part, pylorus or antrum, right here, and you have the lesser curvature and the greater curvature. And of course, leads all into the first part of your small intestine, which is duodenum. And the main function of the stomach is to house all that hydrochloric acid and pepsin and enzymes that will break down food. And the low pH helps break down proteins, and it also kills any bacteria of all the nastiness that came from your stomach or from the outside world. Okay? And that's your stomach. The crypts, the histology of the stomach, they have these things, chief cells, parietal cells. Just know that within the lining of the stomach, there are several different kinds of cells. And one of those cells will create hydrochloric acid, right? Like those chief and parietal cells. But again, they're also, you're going to have goblet cells that also create mucus, because we have to have nice mucosal lining so that that gastric acid doesn't eat through your stomach. But when you get an ulcer, and who are people who have ulcers? High pressure job, they eat a lot of salt, drink a lot of alcohol, right? And then what happens? It's going, that hydrochloric acid is going to start burning a hole through these layers. And then it hits these arteries and veins, and then you have a bleed. Okay. Oh, you have also hormones within your stomach, and you have these cells. We already know the mucus cells, also known as goblet cells, right? They're called goblet cells because they look like goblets. You know, like they look like wine things, wine goblets. Now, what makes hydrochloric acid? The chief cells make pepsinogen to create pepsin, and pepsin breaks down proteins. Now, hydrochloric acid is necessary for the pepsinogen to change into pepsin. The parietal cells make hydrochloric acid, right? And look at the pH, anywhere from 1.5 to 3.5. It's very acidic, very reactive. But as long as we have enough mucus cells, you should be good. Okay? So parietal cells make hydrochloric acid. Very, very acidic, pH 1.5 to 3.5. Chief cells, pepsinogen, and in the hydrochloric acid, very low pH environment, they make pepsin that will break down proteins. And your, of course, mucous neck cells to protect the walls and lining of your stomach. So you could see here that I don't know whatever you believe is the source of human life, you have to now that you study anatomy and physiology, you have to see that this is not random. Someone planned this out or something. If you, I always make the joke because years ago when I first started teaching, a student was very adamant that she wanted the world to know that we came from aliens. So
Oh.
I always say, if you know, whoever you believe, you know, whatever belief system you have, um, um, I always say, even if you believe in the aliens came down to that created you, then you got to admit this is kind of planned. And you could see how it's like a puzzle and how all the pieces of the puzzle have to rely on each other. So you could see how resilient the human body is, and also how delicate it is. How if any one of these parts get messed up, how many other problems are you going to have? Okay, so you should be able to appreciate that. And I believe if more people studied this and more people understood this, on the true wonders of human beings and human life, I think there would be, in my opinion, a little bit more understanding of how we are as behavior-wise.
Mm-hmm.
Now, if you look at this, there's these other hormones and other chemicals, right? And that you might come up with. And gastrin, of course, what will it goes, what will it do? It's a hormone that tells your valves to relax and triggers the muscles that connected, you know, your visceral muscle to move stuff down. Ghrelin, right? This is gets stimulated, deals with hunger and satiety. Satiety is when you're full. Now, notice that these are hormones. And remember the example that I talked about in the beginning of this lecture, that you know, if what do you call that? Like everyone's been there, right, at the buffet where it's obvious you're full, right? You already loosened the belt on your pants. You're already kind of breathing funny, but you're thinking this has got to be the last plate, right? And then you see the dessert tray, right? Now you know you ate already more than enough, but why do you think you can eat more? Is because ghrelin, gastrin, and all these hormones have to travel through your blood to get to your brain to tell your brain, hey, stop, you know, stop eating. So that's also another strategy for those of you who are trying to maintain a diet or helping your patient maintain a diet. If you know your hormones take some time, almost 20 to 25 minutes, to get to your brain to tell you, hey, you're full, well, what can you do? And well, one thing that I did is I no longer go to buffet, because if I go to buffet, I treat it as an Olympic event. I'm trying to, you know, hey, last time I had 7 plates, I'm going to go do 9. I'm going for my personal record, you know? So that kind of place is not good for my personality. So I don't go there. But let's say I do go to dinner and it's a robust place. I eat half of what's on my plate, and then I talk to my family or play with the kids or goof around, or many times I take the babies and I walk around. 9 times out of 10, I won't eat the rest of my plate. I'll bring that home or I give it to the kids. And I've been doing that tactic because I love food. I love fast food. I love greasy food. So if I go to McDonald's, I won't get the Coke. I'll get the burger, you know, with everything on it and the large fries. But what will I do? Shake off some of that extra salt, cut the burger in half, eat the burger, right? Only eat some of the fries. Either give the and if I'm hungry, I will eat the second half. But I'm telling you, if you hold off 20, 25 minutes, you'll be hungry, but you'll be like, I don't really need it. My wife did Grubhub last night and got me a really good diner, you know, half-pound burger from one of our local diners. but I did my strategy. So what happened? It kept me in check, right? Because I know and understand that hormones take some time. Now, stimulates parietal cells to release hydrochloric acid, histamine. Okay, so President goes, we already know that histamine also deals with other things in your immune system, but that's the reason why people who have GERD or people who have who take antacids, there's a form of antacid that's an antihistamine. And now it makes sense because I know histamine stimulates hydrochloric acid, and if I take an antihistamine, it will decrease that acid. Serotonin contracts muscles. Somatostatin decreased motility, decreased gastric motility and emptying. Also, so think somatostatin, think decrease. Stomach, pancreas, small intestine. And we now know what the stomach does, right? Hydrochloric acid, and it also churns the food. It also breaks down things. Pancreas, we already know, pancreas breaks down lipids, and also when we had a good meal, increases glucose to go into the cells. And the small intestine and large intestine, of course, the small intestine is absorption of nutrients. So think of somatostatin as like the blocker or the negative feedback of your GI system. And you look at the word soma, means body. Statin means what? To stand still. So it tells your gastrointestinal tract, stand still. We're done. We had enough. Okay? So these things turn stuff on. Somatostatin, think it's going to turn stuff off. We kind of talked about this. That's a mucosal barrier. We talked about that. Chemical digestion. We talked about that. What's going on? Why is it like this? Let's go to small and large intestines if it'll let me. Maybe I'll, how's this? This and this. And, oh, okay. Okay, small intestines and large intestines. What's the difference? Well, the small intestine has a smaller diameter, but there's more of it, right? It's composed of three parts, the duodenum, the ileum, and the jejunum. And the main function of the small intestines is absorption of nutrients. And of course, if it doesn't absorb something, then it's going to kick it down to the large intestines. And the function of the large intestine, the majority of its absorption is water. And the large intestines will then make feces. And what's feces? Anything that's extra, water and any extra stuff that we can't use as nutrients, that is that's going to end up in the toilet. So you have the duodenum, jejunum, and ileum, and then it goes into the large intestine. And of course, just like the stomach, they have these crypts, and it makes sense that your large and small intestine have these like bumps, because if you do that, it increases the surface area. So the more surface area, the more things that you can absorb, and it makes sense that you have a lot of arteries and veins because you want to absorb those nutrients into your arteries and veins that are down here. Now, do you see also, it also has mucus because we want to not only protect this, when this starts contracting, right, and pushing food down, it'll be easier for the food to move down. Okay, and villi, microvilli, again, moving things down. And, oh, I forgot to mention, let me go back here. You look at the green things, those are called lacteals. You got tons of them. That is part of your immune system. Now, of course, these things aren't colored blue, red, and green. We textbooks utilize those colors to connote a green immune system, blue, venous blood, red, arterial blood. And of course, has a lot of absorptive, and there's different cells. You don't, you can, we already know goblet cells do mucus, but there's Paneth cells, G cells, I cells, K cells. When we go into talking about hormones, especially in pathology, we're going to talk more about these. Now, malt, we kind of talked about that. There's also other immune system systems and nodules all along your small intestine, and it's called malt, right? And they also known as Peyer's passage. And again, there has to be a lot of immune system down there because remember how dirty food is. What is up with my son? Quiet. All right. Okay. Motilin, migrate, chemical. There's some digestion, but remember, just as a general rule, I want you to think of small intestine, it's absorption of nutrients. Large intestine, it's absorption of water and creation of feces. So let's look at the large intestine. Of course, here you have your appendix. Your appendix is a vestigial organ. It serves no real purpose. It used to have an immune function, but now it's just this little tube that sticks out of the first part of your large intestine. Now, here is a problem because if a fecalith, which is a very hard piece of feces, or maybe a foreign body like a peanut or something gets lodged in here, you have a risk for appendicitis. Now, I'm not too worried about appendicitis. Yes, it hurts and you get a fever and all that. I'm worried about when this ruptures and now E. coli, which is supposed to be in here, right, which helps facilitate the creation and formation of feces, is now going to be in my peritoneum. Then I get peritonitis, and then I could have, and with all the arteries and veins, I have now a risk for sepsis. Okay, so remember, many times we're worried about the sequelae and not the actual pathology that's going on. We're more worried about what's going to happen next. Just like with the heart attack. The heart attack, yes, is of concern, but the heart failure that is coming down the road, that's what I'm more concerned about. So you can see here, that's where the appendix is and potential for appendicitis. Cecum is the first part, and then you have your ascending colon, and colon is just a generalized term for large intestine. Then you have the right colic or the hepatic flexure. This is the curve near your liver. Then your transverse colon. Then your splenic flexure, which is near your spleen. Then you have your descending colon, sigmoid colon. Like I kind of imagine this as an S, like that. And then of course, the final part, which is your rectum, and then you have another sphincter, well, a set of two sphincters down here, and that's your anus. So your anus isn't really the tube. It's just like the sphincters at the end, and your rectum is this whole entire tube here. Okay, and you can see how we can do a lower GI series, also known as endoscopy, right? I could stick a tube down here, right? And of course, we empty all this out with a detergent. Stick a tube down here, and then I could see, and I can even do surgeries. There's a whole bunch of things I could use endoscope with. Okay, cancer, rectum. Now, and you could see a lot of folds, right? For not only glandular tissue, there's lymphatic nodules all along because it's got a lot of E. coli in there. And remember, E. coli needs to stay in that tube. It doesn't need to go anywhere else. And it makes sense. All of these folds, all of this microvilli, all of these goblet cells to secrete mucus so we can push the feces along, right? and we're absorbing water. Now, two situations that are not good regarding the colon is, of course, diarrhea, right? If you look at the word diarrhea, flow or excessive flow, and complete or thorough. That means the patient isn't getting any nutrients, the patient isn't getting any water, everything's flowing right through them. And for a very young and a very old patient, that is of considerable danger or potential danger, dehydration. And for the older patient, if they're dehydrated already and their colon is filled with impacted feces, that feces, also known as a fecal lith meaning like stone, it's very hard to remove, it's very painful, and could cause rupture. And again, just like the appendicitis, the impacted feces isn't the problem. The problem is if it ruptures and causes my patient peritonitis with eventual sepsis. So you could see here when you're looking at pathologies, all you have to do is mess with normal, right? And what's normal? Bacteria flora is normal. There should normally be E. coli or Escherichia coli in your alimentary canal. But the thing is, there's no such thing as bad or good bacteria, just bacteria that's too much or too little, or bacteria that's in the wrong place. So E. coli is supposed to be in my large intestine, but E. coli in my mouth or my fingers or my lungs, not a very good thing to have. And bacteria, we need that E. coli because remember the vitamins that we talked about? Biotin, pantothenic acid, vitamin K, which is very important in controlling your bleeding, right? You also have immune responses that require this bacterial flora. And that's the reason why when you take very serious broad spectrum antibiotics, the first thing you get is a really bad stomach ache or intestinal cramping. Because when you're taking broad spectrum antibiotics, you may be killing the thing you want to kill, but sometimes we call it shotgun therapy. You're not only killing the things you want, you're also killing all the beneficial normal flora or bacterial flora that may grow, and then it causes side effects, okay? Mechanical, oh, if you noticed the large intestine right here, did you notice that it had little pockets? You see how there's like little pockets there?
Mm-hmm.
Those pockets are called haustra. And they're the ones that form, that's why your feces looks like the way it forms, right? And once it starts filling up, the myenteric plexus then sends a message, hey, stuff is filling up, and then what will it do? It will tell your anus, the sphincter, your anal sphincters, to do what? Loosen up. And just like urination, when it's time to go, it's time to go. You can hold off as long as you can, but eventually, who will win? The thing that's automatic, right? Because it needs to get that waste product out. And if in the case of impacted feces or severe constipation, that's not a good situation to be, because it's going to mess with the natural process of getting those waste products out. Because remember, too much of a good thing becomes a bad thing. Now, we talked about the liver, the pancreas, and the gallbladder, and you now know from the other pictures where they are. And the liver has major metabolic processes and enzymes. Actually, 5 major metabolic processes and enzymes. And not only filtration, but it also makes vitamins, especially your fat-soluble vitamins. So and all food has to be processed through the GI tract and has to involve the liver, okay? Now, the pancreas, we already know, has it releases a lot of enzymes, and also the 2 major hormones are insulin and glucagon. Insulin when you eat a lot of food, and glucagon when, you know, you're in between meals. And the gallbladder, that's the one that secretes bile, which was, remember we talked about the emulsifiers, the things that break down fat, right? And the liver produces the bile, but the gallbladder stores it and then releases it. And those are your three major accessory organs. And again, you can see without them, digestion would be a pretty hard thing to do. So with that being said, that's essentially your GI system. And let's see if we went through everything we were supposed to go through. Watch the videos, they're nice. This one's nice too. And then you could also have here, don't do the lab, but when you have enzyme catalysts here, nice little review of enzymes on what we talked about before, because isn't this what we're doing with the entire GI tract? I take my food or my reactants, I have enzymes that lower the activation energy to make my products. And what was my products? I need ATP, right? I need energy, okay? And this is essentially a repeat of week 2 notes, if you recall those notes from week 2. So did we go over the structure of the digestive system? Yes, all the players and what all the players do. We talked about physical and chemical digestion. The chemical digestion was the enzymes, right? And the physical digestion was mastication and deglutition. You know, how your teeth and your tongue smash up things, right? And of course, the metabolic reactions and enzymes that are required to break things down. And a quick review of what those enzymes are. Remember, in your mouth, amylase, right? That's for carbohydrates. Then you had the peptidases that are in your stomach, and the lipases that are also in your stomach and in your duodenum, the first part of your small intestine, and also what the gallbladder and liver do to break down fats as well. So that's the fats, carbohydrates, and proteins. And isn't that pretty much the Egg McMuffin sandwich that you ate this morning? And then what are we doing? We want to save the water that we can save, throw out the water we don't want, throw out the extra nutrients that we don't want, specifically nitrogens, hence the term nitrogenous waste. That's what you do when you urinate. That's what you also do when you defecate, right? And also flatus. All of these reactions create gas. So when you pass gas, that's called flatus, F-L-A-T-U-S, right? And again, that has to be at a normal level. Too little, too much, again, the GI specialist will have issue with it. So of course, let's do next week. Kindly perform your concept map that you always do on these 3 topics and try to link them together. Many of you do like 3 nice things, but you know, try putting on your map on how they link together. And what else is due next week is, let's look at the discussion so I can give you a hint. Leaky gut syndrome. So what is the syndrome? How does it occur? What effect does it have? Very, very basic, right? Make sure you have APA formatted citation. And remember, some of you are giving me like term papers, like 1,000, 1,200 words. Let's not go crazy. Like 200 to 400, okay? Just enough to answer the questions. But some of you guys are go-getters, which I don't mind, but, you know, well, you know what? I take it back. You want to write 1,000 pages? I'll read 1,000. I'll read 1,000 words. I'm all right with it. But it seemed some of you guys really take it to heart. And remember, all week 4 stuff is due today, and week 5 stuff is due next week. But try to do 1 or 2 week 5 things, you know, just to get the ball moving. And also look at your Moodle over the weekend, or your now of course this is Moodle, but if you look at here, you click on this, your resources and your self-service portal, or you type in portal.stratford.edu, look at your grades every once in a while. And if you have any issues like how was the grade calculated and all that stuff, give me a call so I can outline it for you. And last but not least, what does lesson 5 look like? And again, we have no midterm. Ooh, here's some enzymes. Don't worry about this stuff. These are nice notes. What do you need to submit is this. You click on that, download case, and of course, it's pancreatitis. You you know what, just do, because you guys probably have midterms, just do questions 1 through 10. That's it, right? You read this and then you Google some of the answers. Very, very straightforward, okay? So that is all I have. Any questions, comments, or recipes?
Did you want to go over anything about the class on June 30th?
No, we're going to go over when we get there regarding the lab.
Okay.
Make sure to wear scrubs and or a lab coat. And if you don't have one, tell me so I can get you one. You know, any mask will do. And we're going to be following the CDC guidelines for social distancing and things of that matter. So when you get there, when you get onto campus, and there's several of you in the elevator, walk it up or wait for the next elevator. Let's not bunch up because we have to adhere to the CDC guidelines. And also we'll be doing, it's kind of like surgery. I'll be showing you how to do hand washing, like the way we do it clinically. So we'll hand wash, we'll glove up, right? And then we'll be doing the lab together, right? As if it was surgery in a semi-sterile environment. So we'll be doing dissections and little things and microscope work, but it'll be done like we were in a what do you call it, a lab in the hospital. Okay, so that no one gets any contact, and of course the laboratory. My responsibility is the lab, and you guys have to please, another public service announcement. Please answer me back to tell me that you're confirmed for those dates. If you're not confirmed, I cannot let you in lab, okay? Because there's a limited amount of people, all right?
Is that at 10 o'clock?
Yeah, it's at 10 a.m., right? So, and if you can't make that, there are other laboratories, if you saw the list, or like you can't make those, tell me so I can bunch other students who can't make it, because many of our students, they work in the medical field, and from week to week, their schedule, it depends on the patient load. So, you know, like, oh, I can only come Saturdays, or you know, please inform me and work with me so that we can, you know, we can get you your labs. All right? Because you paid money for this. The labs are important. And grades wise, yeah, you know, it's incorporated in there somewhere. But again, this is more to enhance, because this is neat and all that we're doing lectures and whatever, and you're doing your case studies and whatnot. But it's really important that you actually see a liver, touch a liver, cut it open, and actually look at it, so to solidify all the things that we talked about today. Right? So remember, scrubs and or a lab coat, and don't wear anything that you know, wear something that you'd be comfortable in, and then you know, that you don't like, just don't wear nice things. Don't try to also carry too much, right? Bring textbooks or no, you don't. Just need a mask and some PPE. And if you don't have any, please inform me so I can get you some disposables. Alrighty. That's it. I'll see you guys next week, and have a good one.
All right. Thank you very much.